This is a question about health care and health insurance. One of the problems with our current health care and health insurance issues is that we have an intervention-based system that waits until we're catastrophically ill before it kicks in. The real trend has to be that we move to a prevention-based system so that the dollars are spent preventing the disease rather than treating the disease after we've already gotten it. Let me give you an example. 80% of all of the healthcare dollars in this country, $2 trillion a year, 80% of that is for the treatment of chronic disease that we could have prevented or cured had we put the money on the front end and had we had lifestyle adjustments that better prepared us to live. But instead, a combination of our American lifestyle, overeating, underexercising, and smoking, those are the three behaviors that pretty much drive chronic disease. Issue there, plus that our coverage doesn't kick in until we are really, really catastrophically ill. I'll give you a couple of examples. Most insurance policies will not cover a $150 visit to the podiatrist, but if you have to have a $30,000 foot amputation, it covers that. It won't cover $200 so that you can see a nutritionist and develop a lifestyle system so that you might be able to be healthy, but if you have a quadruple bypass and it costs $120,000, it'll cover that. Now, does that make sense to anybody? That you would? It's sort of like the old Valvolin commercial, pay me now or pay me later. What's cheaper, the oil filter or a new engine? And so what we have to do is to start rethinking and reprocessing the way in which we structure benefits. We started doing that in my state, ending the copays and the deductibles on colonoscopy, mammography, prostate cancer exam, paying 100% for the cost of smoking cessation programs, weight loss programs were covered in insurance because we found that by helping people to maintain their normal body weight, it saved more money than the weight loss programs cost. Because the fact is, if you become type II diabetic, you're going to average 8.3 days in the hospital at least as a minimum every year. And that's going to be astronomically expensive. That doesn't even begin to count the medication and the testing supplies. It doesn't take long for it to add up. And we have a true epidemic on our hands in terms of chronic disease. So the whole system, it's not a matter of just making some adjustments in the program. That's where a lot of the, I think, programs are failing. And let me say, I think some of the approaches from both Democrats and Republicans are wrong-headed. Democrats tend to say, let's turn it over to the government. And the Republicans tend to say, let's just turn it over to the private insurance companies. Well, I don't know about you. I don't trust private insurance companies any more than I trust the government. I trust me. If somebody's going to be responsible for my future, my health, and my life and my death, I really believe I care more about it than a clerk at the insurance company or a bureaucrat in the government. So what we need to do is have a healthcare system that empowers you to own your healthcare policy. It's portable to you, it's personal to you, and even if you change jobs, you don't have to lose your insurance. It goes with you because you own it, just like you do your car insurance, your life insurance, or your home insurance. And it's that model that we're going to have to change, structure it completely differently. Let me take one more question. Yes, sir.